Happy holidays. Well, we have a topic that's a little bit serious for the holidays, but still, we wanted to bring it to you. How to prevent cancer. Very serious topic, but we have a naturopathic doctor, Dr. Farr. She's also a holistic nutritionist joining me live from New Jersey. Welcome.
Thank you so much for having me. I appreciate it. Yeah.
Thank you. So yes, please let our viewers know, cancer is such a big epidemic that's been going on, and it takes so many lives in the whole year. So what can people do to prevent it?
Yeah. So cancer is one of those things where that's what everyone's so afraid of. The word cancer itself is very powerful. But nowadays it is become so very common. It's like I'm sure any one of you has a relative or a friend or someone that you know who has cancer. So almost every one of us has experience with someone who has some sort of level of cancer or some form of cancer, right? And especially during the holidays, I think that it's important to talk about it too, especially going forward, because there's tons of ways that doctors don't really talk about, different strategies in cancer treatment, cancer prevention, and management too. So I think there's a ton of conversation that we can have about that topic that doesn't involve the traditional treatments like chemotherapy and surgery and radiation as well. So there's so many other options, and I want people to know that they do have other answers and there's still hope for them, even if you go to your conventional oncologist and they only have a limited amount of options for you. So I think as naturopathic doctors and other like holistic health practitioners, like nutritionists, et cetera, they have such an important role in cancer treatment and management, because we can offer some more integrative therapies that traditional oncologists, they don't have the resources for, or they don't have time for. So I think we're a very good addition to going to see an oncologist, right? And definitely, I think there's a lot we can do for sure. And in my practice, I practice in New Jersey, almost actually weekly. Every single week, I see at least a few cancer patients. And we see a lot of women with breast cancer too. So that's very common. Breast cancer, prostate cancer, I see very much almost weekly. And with things like breast cancer, maybe 20 years ago, we see the ratio of people, or like the percentage of people or women who are having breast cancer, that number would be like 1 in 6 women eventually develop breast cancer, right? Now it's as common as 1 in 3 women. So can you believe how common it is? Eventually 1 in 3 women will eventually get breast cancer, right? And we're noticing a pattern now. It's just more common than ever before. And I think the reason is because of our food quality, our air quality has become so poor throughout the years, and it's only getting worse from here. And so, I hope that we can do something about it, but the increase in the number of pesticides and harmful chemicals in all of our food supply, not only that, but even skincare products that we're using, hair products. People don't really realize that, anything that you're putting in your skin, your hair, anything that you're exposed to, that you're breathing in, the pollution, air quality, of course, drinking tap water that may not be, sometimes you don't know all the harmful chemicals that are inside the water. So it has to be filtered, right? So all of these things combined, are contributing to cancer progression, right? So you don't one day wake up with cancer. It doesn't just happen overnight. Growth of tumor cells occur over years. This is something that's like progressing on a daily basis, right? So if you're not taking care of your health, or if you're just unaware of the things that you're putting in your body nutritionally, right, and all the things that you're exposed to, then it happens over years and eventually you'll have that diagnosis, right? So our goal is to prevent that from happening, making our viewers aware of the different things that they can do every day to prevent something like that from happening. And it's definitely very reasonable. It's possible. Preventing cancer is very realistic too. So I always like to think of little habits every day that's going to help in preventing bad things from happening in the future, right? So anything you can do every day to prevent the level of toxins that come into your body, right? So making sure that you're not drinking poor quality water, you're not drinking from a lot of plastic. So we're seeing also the relationship between plastic and xenoestrogens, which is an excess of toxic levels of estrogen. And that also contributes to a lot of different chronic illnesses, including cancer, right? And making sure that the foods that you're eating also are not toxic either. So, I always like to think as a nutritionist, I have an 80-20 rule. 80% of the time, I try to eat as clean as possible, eating good nutrition, eating a lot of fruits and veggies. But also the 20% of the time, it's okay to be realistic. It's okay to be human and, eat out with your friends or with your family and, and have that level of happiness, right? But nowadays, our food quality is lower because there's a high level of Roundup sprayed in on our crops. So Roundup is basically an herbicide, right? And so recently there's been many different lawsuits coming out for the risk of cancer, especially lymphoma, leukemia. And so it's important also to try as much as you can to eat organic because organic ensures that you don't get any level of chemicals or pesticides in your food that can cause, neurological damage, can cause, cancerous cell growth also. What else do I want to say about the toxins too? And like I said before, with even like skincare products, hair products, there's certain levels of chemicals that actually increase also heavy metals. And if you've heard of heavy metals and the relationship between that and cancer too. So in my clinical practice, I sometimes look at that, a lot of us have been in some shape or form exposed to heavy metals like mercury. Just recently, they took mercury amalgams or dental fillings off the market because that has been shown to cause a lot of neurological damage and brain damage. But it's also linked to a lot of different diseases, not just cancer, but things like autism, ADHD, migraines, headaches, chronic fatigue, things like that. And so, there's ways that you can also detox from those heavy metals on the daily basis. So a lot of different plants actually help bind to those toxins and those heavy metals to get rid of it in the body too. So you have things like spirulina, chlorella, cilantro, parsley. Those are some basic things that you can add to your daily nutrition and your diet to actually help bind to those toxins and get rid of them. And some other things, if you want to go a step further for detox, you can also do things like activated charcoal. That's a simple one that helps. And then a lot of times people like to get IVs or even supplements that contain EDTA. Again, it's a component that binds to heavy metals over time, and it literally gets rid of the mercury and the other heavy metals. And so it's a great way to detox too. So and the other thing that I wanted to mention too about cancer is that a lot of people just write it off as this is something genetic, this is something that you cannot prevent, and you're just doomed because your mom has cancer, your family has cancer, your grandma has cancer. But really genetics only plays a small part of it. Yes, it does contribute to cancer cell growth, right? So say for instance, if like 3 or 4 members of your family have breast cancer, then you are definitely almost 10 to 20 fold more likely to have breast cancer yourself. So what you can do to change that is really everything that you can do with your lifestyle, managing stress, trying to control some of your environmental factors too, nutrition. All of that is going to basically turn off those genes that are cancer causing. So I like to think of it as 5% is genetic, and the rest of the 90% you can actually control by yourself. So you can control all these different lifestyle factors. Mm-hmm.
I think not that's amazing. And you're absolutely right. We're all living in a world of toxicity and pesticides, as opposed to our parents and grandparents used to live. And
Yes.
so, and we have huge more problems now that we have to be careful about. I just wanted to mention real quick, there's a lot of studies that also talk about contraceptive pills for women especially, and correlation with breast cancer and also underwire bra. Have you heard of any of these research, or do you want to comment a little bit on these? This is a sensitive topic, I know. And
Yes. Oh yeah, well, 2 things. Okay, so the first thing was the birth control, which I think even apart from cancer is just so harmful in so many other ways too. And a lot of young women don't understand this either, where when they're on birth control pills, they're just this not only the side effects, but what it can do long term is something that they don't understand either. When you're suppressing your hormones, or when you're with birth control, you're basically controlling the female hormones artificially, right? But over time, it can definitely cause things like, increased blood clotting, right? So thromboembolism is the medical term for it. And that's not always good either, because it can actually increase things like heart attacks, in the future, cardiovascular disease. And not only that, but, some women can actually feel better on their birth control, and that's because yes, your hormones are being suppressed. But what happens when you come off of the birth control, right? What happens when you stop taking it? You go back to your same symptoms, you go back to the same way. And so while you're having issues, so it's not, a lot of women go on birth control because they have menstrual irregularities. So most women actually go on it because they have problems with their menses, not because they want to prevent pregnancy. A very, very small amount of women actually use it for that purpose, right? So we have to address more of the hormonal imbalances and what is contributing to that, instead of giving them like a pill for, oh, here's a pill and that's going to solve all your issues. And a lot of women, they don't even have a time frame. Like, how long am I supposed to be on this? They've been on birth control for 10 years, 15 years, right? And not realizing the damage that it has. And I know that some women also have gone on something called the Depo-Provera shot, which is like a progesterone shot for, again, it's like a contraceptive, right? Birth control. But I found that sometimes it causes long-term harm, and women can't get pregnant after that. They have a lot of trouble producing eggs and becoming fertile. So that's really, really heartbreaking and really sad. And what was the other thing you said? Underwire bras. So yeah, there's some research now, and people are speaking more about the underwire bras, and I hate them, but not, because they're uncomfortable. So who wants to wear a wire bra every day, right? But it's also very constricting. If you think about the structure, it's so tight. It's basically, it's restricting your movement, and it's decreasing circulation in your chest area around your breasts too. So it's not only decreasing the circulation, but impacting lymphatic flow, right? So you have your lymphatic system, which has to be drained and has to work properly, which is also another contributing factor for like cancer progression too, because you have to make sure that you are, you know, either like massaging the area or making sure your lymph system is working properly, so you can detox and you can get rid of whatever toxins that you have, right? And so a lot of people are very stagnant, you know, they don't really think about that area. They don't think about that system at all. So that's also important. And then the underwire, I forget what material it's made out of, but it cannot be good, right? The metal underneath the wire is, you know, it's leaching into your body. So overall, I feel like it's not very beneficial at all. Yeah. So I hope that answers the question.
No, I think that's great. But this is just a quick intro session that we wanted to bring. You know, this is our last session of the year. So it's a very serious topic, but very important topic for a lot of women and men out there. We just are talking about mainly focusing on women in this particular session. But I just wanted to bring that up, what all of us can do to make sure that we don't get any of these chronic conditions or any of cancer or anything else that as we age. That's the whole purpose of that.
Exactly. Yeah. So prevention is always key. And, you know, you can start early. You're never too early to start, really making sure that you are as healthy as possible, because you never know at what age that something's going to happen. And, you know, I see people in their 20s, 30s, 40s get something like this. And it's harder to get the diagnosis and then start treatment and, you know, start managing it and reversing the disease. It's possible, but I think it's harder. You know, it's easier to prevent things from happening, you know. And recently I'm actually reading a book called The 1 Minute Cure. And it talks a lot about like oxygen therapy too. So if you think about it, oxygen is needed for life, right? To sustain yourself. But everything that we talked about is depleting the oxygen from our body. So every day we're getting more dehydrated, we're losing a lot of oxygen. And so any kind of virus or bacteria or even cancer cells, they thrive on an environment with low oxygen. So they thrive on it. So if you're not feeling well, it means that your body is in a state where maybe your immune system is a little bit weaker, but you're lacking that oxygen. So we have to sort of replenish that on a daily basis, right? So again, a lot of things that we talked about, you know, maybe in a different session, we can talk about different foods and fruits and different vegetables that actually contribute to more oxygenated cells, right? But some people really seek, again, these alternative treatments. They do, you know, ozone therapy, or they do hyperbaric oxygen treatment. And then there's so many ways to get, you know, some people do like a nebulizer, they breathe in more oxygen. So anything that increases that is going to help tremendously for that too. But overall, you know, I think that there's so many great things that we can do to start, even like during this season where we're fighting this, you know, the COVID virus. So we're trying to keep on top of the antiviral. And one of the ways to really do that is to strengthen the immune system. So I think the core of everything also is to really make sure that your immune system is working properly, because every day we're fighting some kind of pathogen. We have different levels of pathogens in our body. Every day we actually are exposed to cancer cells. We have cancer cells in our body. But the important thing is that we don't want to feed it too much, right? So when we have a strong immune system, every day it can actually work to fight off those cells and kill those cells. So the more antioxidants that you have, the more oxygen that you put in your body, the more that you strengthen your immune system and prevent all those triggers and toxins, the better it's going to be for you. And I think that over time, it's you know, it's really going to prevent a lot of different diseases and illnesses from happening. So yeah, a lot of information, sorry.
I think it's great. This is our last session for the year, so very informative session, but
Very informative, yes.
very amazing session because all of us need to focus on the prevention rather than like Dr. Farr said earlier. Well, happy holidays, not to scare everyone, but the whole idea was to give preventive measures and tips to think about it during the holidays, and we come back in the new year again with new and amazing sessions, and we're also launching workshops. So everyone, happy holidays and happy new year. Thank you so much for your support, everyone. Bye-bye.
Thank you so much. Bye.